There's a lot of things that you can look for in trying to avoid getting to the point where someone's suicidal. Becoming suicidal isn't something that just happens overnight. It's not just you'll go to bed happy and the next day now you're suicidal. Things happen. Depending on the age of the person, if I've got a teenager who's, and I'm worried about, one of the things I'm going to worry about is they're going to be more recluse. They're going to be avoiding family interactions. And they're going to avoid family interactions for a long period of time. So if they're just having a bad day, don't get worried, but see how long that kind of behavior is prolonged. Have they been recluse for a while? Number 2, will they talk with you? Will they talk with you about what's going on? And if they're not willing to talk with you, will they be willing to talk to a counselor or a therapist? Maybe they have a school counselor that you can refer them to. Let the school counselor know that you're concerned about your son or your daughter and that they've been kind of recluse. How are they at school? If at school the same behavior is kind of being manifest, that they're quiet, they're withdrawn, that's another concern. And so now what we do is we say, oh, this person is withdrawing for some reason. We can't always assume what that reason is. We need to explore that. So we ask them questions. We try to spend more time with that individual. See what's coming out. Are they having some relational conflict at school? Is there some tension, maybe some bullying or broken heart feelings? Is there some guilt, some behavior that's been happening? Maybe that's just organic or chemical depression that just maybe needs some medication. There's something going on that causes that shift in behavior. And without attention, that behavior can grow. So make a note of that behavior and then start talking about it. Next step. One of the things you're going to notice is they're very irritable and they're ornery, they're snappy. Okay, this does not mean that they're suicidal, but it is something to look for. As they move on and this behavior is continued and you can't get them to see a counselor, you can't get them to open up, okay? The next thing that you're going to see that's going to be a concern, and this is one of those things that is a real big flag. They've had a pattern of behavior where they've been very recluse, they've been very mean, they've been very awful, and then they start being very giving. They start bequeathing, so to speak, their property. The things that they really enjoyed, like their iPod or their electric guitar or certain things that they love, they start to give those away. And what that means is they're kind of tying up those loose ends before they do. And what's interesting is when they're doing this, their affect or their mood becomes lighter. They're happier. Don't get seduced into having a birthday cake of relief that now they're pulling out of that depression, because it may be that they've made the decision that they're going to check out. So if you start seeing them do those kinds of things, be aware and then get outside help. And if you can't, you might need to force it. Bring them to the hospital, tell them that you're concerned. These are the behaviors that they've been doing for this amount of time. School's going to drop. Their classes are going to drop because they're not going to put any attention in that. They're going to be defiant. So now we have oppositional defiant disorder. Plenty of reason to be taken into the hospital to get medication management and counseling and support from group therapy. So there are strategies that you can do when you start seeing these signs long before they get to the actual suicidality. In conclusion, if you have a situation where someone's withdrawing and you're concerned about it, go ahead and do some intervention, force an intervention. If their grades are dropping, if they're socially withdrawing, maybe they're doing some cutting, they're writing poetry, they're journaling that life is awful. Force an intervention. And one of the ways of forcing that intervention is take them to the hospital, explain the list of symptoms that have been going on. That diagnosis of oppositional defiant disorder or depression, those are plenty of reasons to have someone go to the hospital and be kept there for observation and treatment. And now they've got psychiatrists seeing them, therapists seeing them, they've got group support going on. And so it may be just the intervention that they need to bring them out of that depression so you don't have to start dealing with that suicidality.